Dr. Ameyo Stella Adadevoh was my aunt. She was my mother's senior sister. This is not something I read about. She was not an infectious disease physician. She was an endocrinologist, though. She just went to work one day. She just happened to come across a man who, of course, we now know was later confirmed to have Ebola. She just had a gut feeling and she just knew that this man cannot leave. And that single decision that she made changed history for Nigeria and many other countries because he was going for an ECOWAS event.
Good morning, good afternoon, good evening, depending on where you are joining us from. I am excited to bring you another wonderful episode of The Adventures. I am Kunle Olufemi, your host. As you know, on Adventures, we seek to bring you the stories of vision and courage behind the brands and the organizations that you see around you every day. By sharing their stories, we aim to help our audience avoid some of the pitfalls that they experienced and, of course, consequently, achieve stability and growth faster than those organizations. It's my pleasure to introduce to some and, of course, tell a little bit about our guest today, who is, very special, right? Our guest today is Mrs. Niniola Williams. She loves to be called Niniola, and she's a prominent Nigerian public health leader whose work focuses on infection prevention, epidemic preparedness, and strengthening health systems. As the managing director of DRASA Health Trust, she oversees programs that train frontline health workers, build community level disease prevention capacity, and improve Nigeria's readiness for outbreaks. Her role as a faculty at the University of Lagos of College of Medicine, Center for Infection Disease Control and Patient Safety, further positions her at the center of national efforts to professionalize infection control training and equip health workers with essential skills. Her career also indicates impactful work with management sciences for health, contributing to major public health programs addressing HIV/AIDS, tuberculosis, malaria, microbial resistance. Williams' leadership has earned international recognition, including a feature by the Skull Foundation and an award in the GDA 2022 Digital Skills Competition. Thanks once again for coming on The Adventures, Niniola. Great pleasure to have you around.
Thank you for having me. It's good to be here.
All right. Yeah, and please, I apologize for probably just not pronouncing some of some of those titles and some of those, um, jargons within the scientific space correctly. But it's really an honor to have you here, and I want to start by asking you to, tell our audience, right, our viewers a little bit about what you do, right? Possibly if you can double click into some of the, the scale of what you do and the impact you're making, I think that will be very helpful.
Okay,
All right.
great. Thank you.
Thanks a lot. Yeah.
And thank you for this opportunity. So, I have been leading the Dr. Ameyo Stella Adadevoh, or DRASA, as we like to call it, Health Trust,
Mm,
public health organization for 10 years. And what we do is essentially developing people into what we call health champions, ensuring that we have a network of these champions across the country who can drive change and improve the healthcare system while also working with federal, states, and local government authorities to shape policy and institutionalize disease prevention. Everything we do is about keeping people healthy and safe and keeping them away from the hospitals. But if they do have to seek care, our role is to ensure that they get quality care. And so that's really, at a high level, what we do. What that looks like on a day to day has varied over the last decade, but I can give you examples. So far we've been able to equip 96,000 health champions, over 90 health champions, across 32 states in Nigeria. We have trained and certified 15,000 healthcare workers. We have also worked with the government to review and develop 28 national and subnational policies and guidelines. So, again, our work is sort of grassroots community participation and also government partnership and policy. So, looking at things from two ends, from the top down, the bottom up. And so, in a very practical sense, what does this look like? For example, right now, we're working with state governments to strengthen what we call infection prevention and control, which is really just to say that we're putting in an accountability system so that health facilities in the states that we're currently working in have a way of ensuring that when patients come for care, they don't um, contract any infections while in the hospital. Hospitals are places where there are sick people, so there are lots of germs and things spreading. And so we all know stories of people who went in for one thing. While they're there, they develop something else. They end up on admission for 2 weeks. Their bill is much higher than expected. And there's this ripple effect of what that means for that individual, their personal outcomes, and their family. So ensuring that there's safe quality care, health workers are protected, patients are protected, and putting in systems and accountability, tying it into things like the licensing of the hospitals, making sure that they're reporting data and they have key indicators that are being tracked for that is one of the things that we're doing now. So, really working at the systems level to make sure that policies are not just pieces of paper on a shelf, but they're being embedded into the everyday work lived experience of patients and health workers. And then on the community side, we are very, very passionate about turning everyday people into disease detectives. So we have another program that we're running in several states that identifies leaders in communities. These can be youth, artisans, traditional leaders. We identify gatekeepers and regular everyday people, market women, and so on and so forth. And we train them and equip them to become part of the public health system. Because ultimately, when issues happen in communities, by the time the government hears about it, it's usually a bit late. Meanwhile, the people in the community are the ones that know immediately when there's a problem with their neighbor or the person down the or somebody in their school, and so on and so forth. So turning those people into disease detectives where they can very quickly see that this baby looks like he has measles and the mother doesn't know. Or this child is stooling profusely. Could it be cholera? Where did the child go and drink water? Identifying issues within the community in a way that is fast enough to get people quick care and reduce, negative outcomes like prolonged hospitalization or even death in many cases. And so making sure that those grassroots influencers and people who are doing their everyday work, you're a butcher in the market, but your role is to make sure that the meat that you and your colleagues are selling is not infected for people to come and buy it. Basic little things that prevent disease and help people to stay healthy and live healthy lives. Is what we do. And then connecting those people to the system so that when there is an issue, they know exactly who to call, who are the local health authorities, who can quickly come and respond and assist. So those are some examples of the kind of work that we're doing now.
And I think it's phenomenal. I think it's phenomenal. Well done, and thanks a lot for, sharing all of that. So, is it okay, Niniola, to assume that the disease detectives are the 96K people that you alluded to earlier?
Yeah, exactly. So that 96K is comprised of health workers, youth, and community members. Those three categories of
Okay.
people who, over time, we have engaged, equipped, trained, and refined, and brought them into a network where they are working. And when I say working, I don't mean it's a job. It's become
Yeah.
part of their role in their community or in their circles of influence, whether it's in their schools. We've been working in secondary schools since 2017. And the curriculum we've been using there, we're now working with federal authorities to see how we can scale it into the secondary school curriculum nationwide. Because we've seen what these young people can do. They do amazing things and they do more than what government can do alone. Our philosophy is that if we want to change Nigeria, we cannot sit down and wait for government to do it. We have to go and help them. We have to be parts of the solution ourselves. We have to have everyday people stepping up, just like Dr. Adadevoh did to change the course of history for the rest of us.
Hmm. Thanks a lot. And I mean, that dovetailed nicely into my next question for you. Speaking of Dr. Ada, it looks like, you know her on a very personal level, right? And, just hearing you talk, I can kind of deduce that this is like a love project or passion project for you. It's not commerce, right? This is something very close to your heart. Can you go a little bit into how it all started? The history. What were the events leading to this? Over to you.
Yeah, so Dr. Ameyo Stella Adadevoh was my aunt. She was my mother's senior sister, the firstborn in their family. And so, like you said, this is not a story. This is not something I read about. This is, what happened to her colleagues is something we all lived through as a family. And after losing her, it took about a year for us to decide exactly what we wanted to do, but we knew that we didn't want to just leave it. She and her colleagues did some extraordinary things. She was not an infectious disease physician. She was an endocrinologist. Nope. Her specialty was, in fact, diabetes. She was an endocrinologist, though. And so she was in a private practice. She had been there for 21 years. And she just went to work one day. She just happened to come across a man who, of course, we now know was later confirmed to have Ebola. And her suspicion was correct. Despite all the pressures that she faced, she stood her ground and she refused to let him leave to attend the conference he was going to. She refused to discharge him, despite all the threats she got from that they're going to arrest her, she's kidnapping him, because she didn't have a confirmed diagnosis. She just had a gut feeling and she just knew that this man cannot leave. And that single decision that she made changed history for Nigeria and many other countries, because he was going for an ECOWAS event. So he would have infected diplomats from, West Africa region. And so looking back at it, it was a very painful time for us when she got sick and eventually passed on. And we just knew that we couldn't let it go like that. What she did was um, an example of the person she was. When we talked about it as a family, I'm not sure I could have done what she did. Many of us would have run away, knowing the risk, knowing what could come. But she was always that person who put others first and lived a very service oriented life. And so, based on that, we had to do something to continue that legacy. And that's how a year later, the DRASA Health Trust organization was born. At the time, I was already working in public health, working for MSH, as you said, working, on different projects in different countries. And it was time for me to come home and focus on building this organization into an institution that could, help disease prevention across the country. So that's what we've been doing
Mm.
for the last 10 years.
Wow. Wow. Thank you. Thanks so much for sharing that. So you've basically dedicated your life to the prevention of, diseases in, should I say Nigeria or sub-Saharan Africa,
Yeah.
or
Yeah.
what are you looking at? Nigeria
No,
or
our scope
beyond?
our scope is beyond Nigeria. We've been working in Nigeria alone, but of course we know that whatever happens in Nigeria affects the whole world. So Nigerians travel, diseases travel, and again, we're focused on, yes, the big ones: Ebola, Lassa, all those ones that make headline news, monkeypox or mpox as it's called now. But we're also focused on the everyday infections that cause people to miss work, miss school, end up spending so much on medications and treatments. Many of us, even now, we've experienced this new malaria that is resistant. You take malaria meds, it's not going, you have to take another course, or you take antibiotics, it doesn't work, they give you another one. All of these little things that are happening to people around the country on a day to day basis, whether it makes headline news or not, that's what we're trying to prevent.
Hey, thanks a lot for taking the time to watch the podcast. We are super thankful for you taking that time and investing the time to learn. We hope that you find the story inspiring, and beyond that, that you've been able to articulate one or two things that you want to do differently in your own entrepreneurial journey. May I encourage you to please like, subscribe, comment, and please share the word within your own circle of influence, especially within those that you think are on the same entrepreneurial journey with you. May I also encourage you to please, beyond subscribing to our YouTube channel, follow us on our other social media platforms. That means a lot to us, and we can see that that helps us to track that we're making some progress and so making some impact. Thanks a lot once again for taking the time to watch, and to see you on the next episode.